Assalamu alaikum. This is Muhammad Maher, and today we're gonna talk about the thyroid gland. So, I have to point out that this video doesn't cover everything about the thyroid gland, and uh, I guess I mean it does cover mainly like the anatomy, physiology, pathology, and histology uh, of the thyroid gland here. Though, please keep in mind that this is only like an overview, or I should say like some sort of like revision for those people that want to uh, I guess watch this video before the exam or whatever. But you could also like treat it as some sort of like introduction before you start reading the lectures itself that has been made by the university. So yeah, we're gonna start here. What is the thyroid gland? Where it's literally the biggest gland in the body. It's located here in the trachea, right? It kind of like it hugs the trachea, and it's butterfly shape, but it's not connected from the dorsal view here. You see, this is a dorsal view. This is a thyroid gland, obviously. It's not connected, and behind it is obviously the four parathyroid gland. So the thyroid gland here is at the level of in terms of the level at the C5 to T1 in the vertebral level here. But this is, by the way, a question here on that came on the exam. It asks something about at what level is the thyroid gland, I guess, in terms of like the tracheal rings. And the answer for this for that question would be the second to the fourth tracheal ring. So yeah, keep that in mind. And yeah, we're gonna go back to this. The thyroid gland produces three types of hormones. So what are those hormones? Those hormones are uh, thyroxine, which is T4, and tridothyro tritothyronin, which is T3 here. It also produces calcitonin, which is important for like calcium and stuff. So T4 and T3 here it's like two important hormone for the metabolism in the body, right? It helps the body to like metabolize, I guess, food and whatever. This is why when we have like too much of these two hormones in the body, usually one of the symptoms would be like hypoglycemia, because it's basically like your body is like reducing these thyroid hormones, and it's like breaking down or like overusing the glucose in your body. And same thing with the opposite. If you have too little of thyroid hormones, you're gonna have like obesity, hyperglycemia, and so on and so forth. So the thyroid gland is literally the very first gland to ever develop in the body. So why is that? Because of the I guess the important functions of the thyroid gland. It's mainly important for the metabolism, which is important for like I guess the growth of the embryon here, and it starts developing in the foramen cecum, which is literally at the base of the tongue here. But as the embryon develops, it kind of like descend into below the hyoid bone. This is the hyoid bone, by the way, and this is the thyroid here. So it descends into the thyroid area here, which is on the hyoid bone. Um, So first develop it. Okay, that's the thyroid base. Okay, we covered these two. So next page. So as we said, second to the fourth tracheal ring. This is a question. Don't forget about that. Fifth uh, C vertibular to the T1 vertibular. C5 to T1. So this is another question. Again, pay attention. So one of the spotter question had something about, hey, it says something like what is the name of this uh, vein? And the answer would be the intrajugular vein, right? The next question that that is right after it, it said something about which one of the following is, I guess, nerves are the closest to the interjugular vein, and that would be the vagus nerve, which is like literally right here. So it's like these three are like very close to each other. The common carotid artery and the internal jugular vein here, right? I hope that's clear there. So this is the trachea, obviously. The fascia, pre-tracheal fascia. Uh, okay, this one. Okay. Uh, Now we go to the blood supply here. Uh, in terms of the blood supply, obviously the thyroid gland is like rich in blood supply for so many reasons because it's like literally one of the most important glands in the body. It's really important for like for growth, for metabolism, for a lot of stuff here, and so it needs like a lot of blood supply to be able to be working. And mainly here, the arteries that connects into the thyroid gland are mainly four arteries, uh, two on each side. So you have here like the aortic arch, obviously. It has three branches, as you can see, three branches. One of them is subclavian arteries, right? Subclavian artery here. This goes to the right limb. Uh, this is also subclavian artery, right and left subclavian arteries. But it also has, I guess, um, it gives away another artery that is called the common carotid artery. This common carotid artery uh, separates and makes another artery called the external carotid artery. This external carotid artery has a branch. Can you see it? It's right here. This branch. It branches into superior thyroid artery. And so the same thing in the inferior, though it doesn't come from the external carotid artery, but rather from the common carotid artery. This is the common carotid artery, and it supplies the inferior part of the thyroid artery. Meanwhile, the external carotid artery supplies the thyroid artery. Yeah, that's pretty much it in terms of arteries, I guess. Now the veins. The veins are also somewhat a little bit complicated, but not too much. So this is obviously the superior vena cava, right? Um, so the superior vena cava has like two subclavian veins, sorry, right and left, right? Uh, the left one has the left internal jugular, and the right one, right interjugular vein, internal jugular vein. That's how we say it. Yeah. The internal jugular veins uh, s- um, gives rise to two veins that is called superior and middle thyroid veins, right? Very simple. But the inferior, you have the superior and middle, obviously. The inferior thyroid veins doesn't come from the internal jugular vein, but rather from the vena cava. There's like a vena cava one here, and the subclavian vein. So this depends on what type of like the books that you study about medicine, but some medicine books says it's like there is only like one I guess inferior thyroid vein and only comes from the vena cava, and other books would say like, hey, no, there is like two of them, One of them come from the right, sorry, the left subclavian vein, and the other from the superior vena cava. I would say both are true, but let's just like stick with the one that is in this video, or whatever that is in, I guess, the sheets that exist from the I guess the university. But yeah, anyways, the thyroid physiology of the hormones, and this is more of a histology actually than physiology. But I'm gonna explain this. Yeah, it does have physiology here, but yeah, I'm gonna explain. So basically, these are the cells of the thyroid gland here. Uh, we call those lobules of the thyroid. It contains something that we call collocoid. This is supposed to be D, by the way, not O. Sorry about that. So collocoids are are like the cavity inside a group of cells that we call follicle cells. Now, follicle cells are about like 20 to 40 cells, right? And they gave rise to the collocoid. Obviously supplied by blood cell, blood cells here, or I guess cavities. So the follicle cells produces thyroid hormones. And what are those thyroid hormones? They are the thyroxine and tritothyronin, tritothyronin. Basically T4 and T3. Uh, so they are important for increasing the metabolic rate in in the body. So what happens if you have too much thyroid hormones, T4 and T3? Well, what happens is uh, it kind of like creates a negative feedback on the hypothalamus here, which tells it to stop producing, I guess, thyroid releasing hormone, thyroid TRH. Ask it to stop producing TRH. And low TRH levels means low levels of TSH, which uh, thyroid stimulating hormone. Yeah, thyroid stimulating hormone, TSH. Uh, comes from the anterior pituitary gland. Low thyroid releasing hormone means low thyroid. I forgot about that. Low thyroid stimulating hormone doesn't stimulate the thyroid, then you have less thyroid hormones here. Um, so what happens if you have low levels of thyroid hormone here? So there are mainly like three causes here for like uh, I guess thyroid low levels of thyroid hormone, and that would be primary, secondary, and tertiary. Tertiary, tertiary hypothyroidism. Tertiary hypothyroidism. Okay. Um, so the primary one is pretty easy. It's basically like a problem in the thyroid gland. Could be something because like I don't know, like an immune, I guess, autoimmune, uh, or like I don't know, like some sort of like damage or low blood supply. Basically, it has like or maybe like an infection even. Mainly like a problem with the thyroid gland here. So a secondary problem would be in the anterior pituitary gland here. Maybe it has like some sort of like adenoma, or even rarely sometimes carcinoma, right? It could have, I guess, the efficiency. It could be something like it could be anything. Yeah, it's just mainly like a problem in the pituitary gland, or specifically anterior pituitary gland, which means low levels of TSH. TSH is the one that I guess activates the thyroid gland to produce thyroid hormones. The third reason is the triad tertiary thyroid hormone. It's basically the third reason here. It could be something like something in the hypothalamus. Maybe the hypothalamus has a problem. Maybe it reduces less TRH, right? This could cause, I guess, low TSH and then low thyroid hormone. So low thyroid hormones means low metabolic rate. So a patient would just like be feeling like lazy, depressed, slow, everything like it's just like so slow. Everything is so slow around them, and uh, they would like have like, I guess, constipation. Well, I don't know what that means honestly. Mainly they would be lazy, depressed, slow, uh, hypo hypoglycemic, and all of this. So we're gonna skip this one for now. We're gonna come back to it. So hypo. Actually, we're gonna start hyper. That's hyper. Yeah, hypothyroidism. We're gonna continue on that. So low levels of hypothyroid hormone commonly caused by low iodine intake. So the most common cause of hypothyroidism is low iodine intake. So where does iodine come from? So people like uh, you know how like some people that lives in the coast, like I guess next to like a beach or something, where they always smell the sea water, salty water or whatever. There is like rich of iodine. Like this area is are mainly like rich with iodine, right? And iodine is very important for the I guess making of thyroid hormones. But then when you have people that lives away from, I guess, the beaches or whatever, it kind of like it creates some sort of like deficiency because there is no intake of like iodine. Like very much the only way you could ever like get iodine is by consuming rich iodine salts, which is sold in the supermarkets or whatever. But yeah, main idea is iodine is very important for production of thyroid hormone. But how is that? I'm gonna explain here. So the thyroid hormone, obviously, follicles, colloids, right here. What happened is here, blood supply. So this is the blood supply, right? It has two sodium and iodine, and so what happened is the sodium iodine it's basically sodium iodine pump or whatever. It takes two sodiums and one iodine and gets it inside the I guess follicle cell here. And so what ends up happening is only the iodine gets inside the colloid, which help with the production or like a production of thyroid hormones. Um, that's like the main idea here. Uh, so basically, this is how important iodine is in the, I guess, production of thyroid hormone. It can be caused by autoimmune, yeah. So autoimmune can be a cause of hypothyroidism, mainly like a damage in like the thyroid hormone. So basically, hypothyroidism can cause clutter. So this is like a spotter question here, so you have to pay attention. I remember them showing something about the clutter, which is like an enlarged thyroid gland, right? Someone's neck would be like very thick, like that. That is something that we call clutter, and we have something like a question would be something like, I guess, uh, why is it caused? And the answer would that be hypothyroidism or low iodine intake. Maybe it would be something like a question that would be like, hey, which of the following causes glutter? And the answer would be low levels or like low intake of iodine. Secondary causes in in a case of like a secondary causes, the anterior pituitary gland produces less TSH or ACTH, basically hyperparathyroidism, hyperpituitarism, hypopituitarism. Sorry about that. Basically, like your anterior pituitary gland produces less pituitary hormones, which can be caused by infection, by tumors, or even radiation. Basically, any of the that mainly cause these symptoms. So, what are the symptoms of hypothyroidism here? Hyperthyroidism may cause weight gain, fatigue, dry skin, hair loss, edema, and even slow metabolism. So, slow metabolism, I already explained why. But why weight gain here? So, remember how I said that thyroid hormones are important for the metabolism of the I guess the body. So the more the more thyroid hormone you have, thyroid hormones, then the more metabolism, and the more metabolism, then the less glucose in your body, right? This is why when you have too much thyroid hormone, then you have less glucose because it's basically being used uh, to the cells. But here's the thing: when you don't have that much thyroid hormone, low levels of thyroid hormones, then you have less metabolism. And when you have less metabolism, then how is gonna like help with the metabolism of glucose? So basically, glucose is just gonna like go up and up. It's gonna create hyperglycemia, right? And even like it could even develop into I guess diabetes mellitus in the long run. um, so what ends up happening is you have the high levels of glucose, right, which triggers the pancreas to produce insulin. Sorry, insulin here. uh, why insulin? Well, insulin helps with I guess lowering the levels of glucose here, but it kind of like it basically encourages the body to make more glycogen, right? So the more glycogen you have, then the more I guess uh, the more storage, but because obviously your liver can't just like store that many I guess uh, glycogen, right? So what ends up happening it gets stored into lipids or fatty acids, which explains why people with low levels of thyroid hormone has weight gain. Obviously, fatigue because your body can't use this glucose, right? Dry skin, hair loss, edema, and slow metabolism. Um, okay, this is mainly like the hypothyroidism. So about the hyperthyroidism, basically high levels of thyroid hormone in the blood can cause anxiety, insomnia, high appetite. Why high appetite? Well, basically your body is like literally burning out the glucose in your body, right? And so you would feel like you need to eat more and more, um, and it can even cause hypoglycemia. Yeah, hypoglycemia right there. Tachycardia, hyper hyperactivity, yeah, because all of this like energy is like being used in your body and you just have to like release it in one way or another. Hyperthyroidism can help it can happen from grave disease. So grave disease here is an autoimmune disorder where B cells produces antibodies that binds into the follicle cells here, which stimulates the production of thyroid hormone. All right, so I think that's pretty much it. Uh, Keep in mind that it doesn't cover everything about the thyroid hormone, so you still have to study, I guess, from the sheets or I guess lectures or whatever. Um, as I said before, take this as a mainly a background to help you with like studying the thyroid gland. And yeah, have a good one.